Fracture prevention with Zoledronate in older women with osteopenia. Definition. This medication is used to treat high blood calcium levels, hypercalcemia that may occur with cancer. Zoledronate acid is also used with cancer chemotherapy to treat bone problems that might occur with multiple myeloma and other types of cancer that have spread to the bones. Zoledronate acid belongs to a class of drugs known as biophosphatids. It lowers high blood calcium levels by reducing the amount of calcium released from your bones into your blood. It also works by slowing the breakdown of your bones by cancer to prevent bone fractures.
Hi, I'm Dr. Andy Thompson, and I'm a rheumatologist. Today, I'm going to talk about Zoledronate for the treatment of osteoporosis. You can visit our website, www.rheuminfo.com, and print off one of our Zoledronate picto pamphlets to follow along with this video. Zoledronate is also known as a class step. Zoledronate is given once a year by a 15-minute intravenous infusion. Now there are 4 things you need to do when taking Zoledronate. First, to help build your bones, you need to take calcium and vitamin D. Your doctor will tell you the right amount of calcium and vitamin D for you. Second, Zoledronate should not be taken during pregnancy or breastfeeding. Let your doctor know if you become pregnant or are planning pregnancy. Third, medicines like Zoledronate have been associated with a very rare problem with the jawbone. Now this problem has been seen after dental work. Let your doctor know if you develop sudden pain in the jaw. And finally, your doctor will monitor your response to Zoledronate by testing your bone mineral density. This is usually done every 1 to 3 years. After receiving Zoledronate, some patients have developed a fever and flu-like symptoms where they feel out of sorts or experience chills, fatigue, and weakness. Now these symptoms are usually mild to moderate and go away after a few days. Zoledronate can cause stomach upset with nausea, vomiting, or diarrhea. Zoledronate can also cause headaches or bone, muscle, or joint pain. Finally, Zoledronate has been associated with abnormal heart rhythms like atrial fibrillation. Tell your doctor if you've had a heart rhythm problem. If you're taking Zoledronate, you should call your doctor if you feel sick after the infusion or if you're concerned about any side effects. For Zoledronate, there are other specific reasons to call your doctor. If you develop stomach pain or trouble swallowing, if you're pregnant or planning pregnancy, if you develop new severe pain in the jaw, and finally, if you're having any upcoming surgery. I hope you found this video to be useful. For more information, please visit our website at www.rheuminfo.com.
Of course, I had the pleasure to attend the New Daily meeting, the International Myeloma Workshop, and of course there was a wealth of new information. But what was important is of course, among several other presentations, is the reporting of 2 large phase 3 trials. One was done comparing denosumab with Zoledronate in more than 1,700 patients. So the question was whether denosumab, which is an anti-RANK ligand antibody and is already approved for treatment in osteoporosis and in breast cancer, would be non-inferior to the present standard, which is Zoledronate. Zoledronate reduces the risk for skeletal-related events, that is pain, bone pain, that is fractures, that is indication for radiotherapy, indication for surgery, and so on. And Zoledronate is the standard, and this was tested against denosumab. And denosumab, which is easier to administer because you administer it subcutaneously, it's just one shot. You don't have kidney function, which you do have. You have to test renal function before administering Zoledronate. so it's much easier, and Zoledronate has to be infused by, it's an IV infusion. So this is the advantage in terms of administration and patient comfort. But the main question is, is it equivalent? And the answer is yes, it was equivalent to Zoledronate in terms of prevention of skeletal related events. But was, as a surprise on top of that, was that it reduced the risk for progression of myeloma by 18%. So you get the same results regarding bone health as with Zoledronate, but there seems to be an anti-myeloma effect in addition. And of course the benefit is the ease of administration and the increased patient comfort. This was one of the highlights. Another highlight was the Clarion study. Carfilzomib has been shown to be very efficacious and has been shown to be superior in when it was compared carfilzomib dex compared to bortezomib dex, which was significantly superior in terms of progression-free survival, overall response rate, and even overall survival. And it was also found to be superior when combined with Refdex as compared to Refdex and others. So carfilzomib has raised many expectations, and the company asked the question whether carfilzomib in combination with melphalan dexamethasone would be equivalent or even better than the present standard, which is bortezomib, melphalan, prednisone. So VMP is one of the standard treatments in elderly patients, and the question was whether KMP is superior or not. So there were very raised hopes that this may be the outcome of the study. Unfortunately, the study did not show an improvement in outcome parameters with the KMP as compared to the VMP regimen. There were even more side effects, a little bit more renal and a little bit more cardiac toxicity with KMP. So the lesson from this study is that probably melphalan is not a good combination partner for carfilzomib, and there are many other options for carfilzomib being used with other partners, but probably not with melphalan. But
Applications in medicine. Zoledronic acid is used to prevent or treat osteoporosis, condition in which the bones become thin and weak and break easily, in women who have undergone menopause, change of life, and not have regular menstrual periods. Zoledronic acid is also to prevent osteoporosis in men and to prevent or treat osteoporosis in men and women who are taking glucocorticoids, a type of corticoid medication that might cause osteoporosis. Zoledronic acid is used also to treat pitch disease of a bone, a weak condition in which the bones are soft and weak and being deformed, painful, or easily broken. Results, pros and cons. Appropriate studies performed to date have not demonstrated character-specific problems that will limit the usefulness of zoledronic acid injection in the elderly. However, elderly patients are more likely to have age-related kidney problems, which might require occasion in patients receiving zoledronic acid injection. Issues applies in Ecuador. Health Ecuador is advising that Taro Pharmaceuticals Inc. is recalify lots of Taro zoledronic acid injection, 5 mg and small levels, because of the potential presence of particulate matter in the drug. Zoledronic acid is used to treat and prevent osteoporosis as well as to treat Page disease. If injected, the presence of particles could cause inflammation or irritation of veins that could cause blockage of blood vessels.
Osteopenia, defined as a T-score between -1.0 and -2.5. Evidence for treatment in these women is lacking. Zoledronate, also known as zoledronic acid, is an intravenous bisphosphonate that is administered at intervals of 1 year or longer. In this randomized double-blind placebo-controlled trial, postmenopausal women 65 years of age or older with osteopenia were assigned to zoledronate or placebo. The primary endpoint was the time to first occurrence of a fragility fracture, defined as any non-vertebral fracture, and vertebral fractures as confirmed by radiographic evidence. 2,000 women with osteopenia were randomized to receive 4 infusions of either Zoledronate at a dose of 5 milligrams or normal saline at 18-month intervals. After 6 years of follow-up, vertebral or non-vertebral fragility fractures had occurred in 122 women in the Zoledronate group, as compared with 190 women in the placebo group, for a hazard ratio of 0.63. Women receiving Zoledronate also had a lower risk of non-vertebral fragility fractures, with a hazard ratio of 0.66. 1,017 serious adverse events were seen in the placebo group, as compared with 820 in the Zoledronate group. There were no cases of atypical femoral fractures or osteonecrosis of the jaw in either group. The authors conclude that in postmenopausal women with osteopenia, the risk of fragility fracture was lower with Zoledronate than with placebo. Full trial results are available at nejm.org.
Hey, it's Sarah with RegisteredNurseRN.com, and in this video, I'm going to be doing an in-depth review over osteoporosis. And this video is part of an NCLEX review series over the musculoskeletal system. And as always, at the end of this YouTube video, you can access the free quiz. So let's get started. First, let's start out talking about what is osteoporosis. It is a disease that thins the bones to a point where the bones cannot withstand that normal everyday stress on them. And this results in fractures, bone fractures. And as a nurse, I have taken care of a lot of patients who have been admitted with a fall, and when they fell, they think that they broke their bone, their hip specifically. But in reality, the hip bone broke and then they fell, which contributed to the fall. And we learned later on that the patient has osteoporosis. So these happen. Now, a type of fracture with osteoporosis is known as Colles fracture. And this happens whenever the lower part of the radius at the wrist, so the distal part of the radius, where it meets the wrist, becomes fractured.
Conclusion. Uncertainty persists as to how best to use intravenous Zoledronate, an undoubtedly effective treatment for reducing fracture risk almost 10 years after it entered clinical practice, in an era of concerning health resource, declining rates of development of new therapies for osteoporosis, and a global increase in the number of individuals at higher fracture risk driven by aging populations. We should strive to optimize that use of existing therapies.
Learning medicine is hard work. Osmosis makes it easy. It takes your lectures and notes to create a personalized study plan with exclusive videos, practice questions, and flashcards, and so much more. Try it free today.
Osteo refers to bones, and porosis means pores. So, osteoporosis is when there's a higher breakdown of bone in comparison to the formation of new bone, which results in porous bones, meaning a decrease in bone density to the point of potential fracture. Looking at a cross-section of a bone, there's a hard external layer known as the cortical bone, and a soft internal layer of spongy bone, or trabecular bone, that is composed of trabeculi. The trabeculi are like a framework of beams that give structural support to the spongy bone. The cortical bone, in turn, is made up of many functional, pipe-like units called osteons, which run through the length of the bone. In the center of these osteons, there are hollow spaces called haversian canals, which contain the blood supply and innervation for the bone cells. Around the haversian canals, there are concentric lamellae, which look a bit like tree rings. The lamellae have an organic part, which is mostly collagen, and an inorganic part called hydroxyapatite, which is mostly calcium phosphate. In between neighboring lamellae, there are spaces called lacunae, which contain bone cells called osteocytes. At first glance, bone may appear inert and unchanging, but it's actually a very dynamic tissue. In fact, spongy bone is replaced every 3 to 4 years, and compact bone is replaced every 10 years, in a process called bone remodeling, which has 2 steps. Bone resorption, when specialized cells called osteoclasts break down bone, and bone formation, which is when another type of cells, called osteoblasts, form new bone.
Thank you.